Indeed, it's our very brain that stops us from becoming Superman with outrageously overpowered abilities. Why? Precisely so, we don't become Superman. One blind sight. First, to achieve capabilities that others cannot obtain, you must engage in training that others do not undertake. In more detail, you would need to collide your head with a car traveling at 50 kilometers per h, seeking all possible ways to sustain a traumatic brain injury, but only damaging the primary visual cortex, known as V1. Your inner brain must remain intact. Alternatively, you could asphyxiate yourself for a sufficient duration to cause cerebral hypoxia, thereby causing predominant damage to the occipital lobe of the brain. What predominant damage is, I will explain later. The main issue is that after you try your utmost, even to the point of death, to damage precisely the necessary parts, you are still not certain to have trained this skill. So is it worth exchanging so much? Blindsight is that strange phenomenon where someone says they can't see anything or only see a blur because of damage to the brain's primary visual area, usually called V1. Yet when you tell them to guess on reflex, they guess right far more often than chance. Here's a classic experiment comparing people who have blind sight with those who don't. Participants fix their gaze on a plus in the center of a screen, so eye tracking can confirm they're not sneaking side glances. Then arrows are flashed for just 30, 100 milliseconds to the left or right within the blind field. The task is to say immediately, under 1 second, whether the arrow was on the left or the right. It's a 50-50 forced choice designed to make them respond on instinct. In that tiny sliver of time, there's no chance to glance over and barely any time to think. After 100 trials, people with blind sight typically score 60% to 80% correct. Even though they'll tell you they were just guessing, those arrows were gone so fast there was nothing to see. Blind sight, in effect, cranks up your reflexes, quick judgments, and obstacle avoidance. You become hypersensitive to motion and ultra-brief cues. You can even point to the location of a faint light off in the distance. If you had blind sight on a battlefield, you'd be a general who never loses, or so the legend goes. The idea is that when V1, the brain's visual screen, is damaged, your conscious sight becomes poor or hazy, but your body sees through a shortcut pathway. That shortcut won't make your conscious vision any clearer, but it supercharges things like reflexes, orienting, and dodging, Spider-Man's spider sense vibes. The price, though, is brutal. Real brain injury and being legally blind or barely able to see. Sure, it sounds a bit superhero-y, but that's a very costly origin story. 2. Hyperthymesia. Hyperthymesia, also called HSAM, highly superior autobiographical memory, is an extremely rare condition in which a person can recall almost all of the autobiographical events of their life by exact date, quickly, in striking detail, and with long-term stability. Ask, "What did you do on June 12th, 2004?" And they might answer immediately, "It was a rainy afternoon. I wore a blue raincoat. At 5:12 p.m., I had an argument," along with the surrounding context, smells, and feelings. If you test them again months later, the answer is nearly identical. Importantly, this is not photographic memory, and it's not a memory for everything. Their advantage is mostly in long-term autobiographical memory, what directly involves themselves. While other domains, like learning new vocabulary or recalling random lists, aren't necessarily superior. The mechanism isn't fully understood. Studies have reported in some HSM individuals differences in the hippocampal temporal network and basal ganglia, for example, the caudate, in structure connectivity compared with typical brains, along with a habit of frequent reminiscence, essentially reviewing their life calendar day after day, which may be both a consequence of HSAM and a factor that reinforces it over time, a kind of unconscious practice. HSAM isn't a psychiatric disorder or disease, but it does have a downside. Memories, especially negative ones, can intrude powerfully, making it hard to let go and move on, fostering a tendency to get stuck in the past, and sometimes disrupting sleep due to constant recollection. Some individuals show mild obsessive-compulsive traits, love of organizing, dates, lists, and a more introverted style, though this isn't universal. Assessment typically uses date event tests, presenting public dates like inaugurations, disasters, etc., then asking what the person did that day, plus consistency over time, retesting weeks to months later. There's currently no evidence that a typical person can train into HSAM, Mnemonic techniques can help learn new information, but the HSM ability to recall one's life by date appears to stem from a mix of biological differences and long-standing reminiscence habits. In short, hyperthymesia is extraordinary memory for one's own life, impressive and valuable for storytelling and cognitive science. 3. Mirror pain. Mirror pain is the phenomenon where you feel pain or bodily discomfort when you see someone else in pain, and the sensation shows up automatically, naturally, and at a clear spot on your own body, not just a vague ouch of ordinary sympathy. For example, if you watch a needle go into the back of someone's left hand, your own left hand may twinge. Some people feel it on the right instead. Mirror pain has two main flavors. Physical pain. You hurt right where you see the other person get hurt. Emotional pain. You feel tense, nauseated, shaky when you see someone in that state. Mirror pain tends to be stronger when you focus on real injuries or watch movies, gosh, videos with close-ups of skin, especially from a first-person angle, as if through your own eyes, or in high-threat scenes, sharp weapons, blood. It gets weaker if you're distracted or, for sure the scene is staged. In the brain, when you observe another person in pain, your own pain and touch networks also light up to some degree. Roughly 1–2% of people have a pronounced mirror pain, and it's not a disorder. How to self-check. You notice repeated, consistent, clearly located pain when viewing similar clips. Lab tests often use needle injection videos to see whether those images automatically trigger sensations on your skin. If you ever feel overloaded, try slow breathing, press lightly into your palm, and clear the injury imagery to pull attention back to your real body. On the flip side, in the right setting, mirror pain can be an empathy advantage if you know how to regulate it. You may be highly sensitive and able to resonate with others in a very genuine way. So, would you want to have mirror pain for alien hand? Alien hand is a rare neurological disorder in which one of your hands acts as if it has a mind of its own, performing goal-directed actions like grabbing, pulling, unbuttoning, or switching off the TV against your will. People are fully aware of what the hand is doing, yet feel no control over it, often describing it as, "This hand doesn't belong to me." Unlike a tremor or a meaningless spasm, alien hand movements are purposeful and can even oppose the other hand. For example, the right hand buttons a shirt while the left immediately undoes it. So-called intermanual conflict. Common causes are injuries to brain networks that control voluntary movement, typically showing up in two main forms. Callosal, corpus callosum type, damage to the corpus callosum, for example, after a stroke, disrupts coordination between the two hemispheres, so the alien hand may defy the intended command. Anterior, frontal, SMA type, damage to the supplementary motor area, SMA, leads to an exaggerated grasp utilization response. The hand compulsively grabs and uses objects it encounters. Diagnosis relies mainly on a careful history plus direct clinical observation to distinguish it from seizures, tremor, or other movement disorders. There's no single curative treatment, but several management strategies help. Keep the hand busy, hold a softball or cloth. Wear a glove, shock mitten to dampen the grasp reflex. Tuck the hand into a pocket or waistband when you need to concentrate. Declutter the environment to reduce triggers. Use self-cueing, stay still, don't touch, to reassert control. Physical and occupational therapy to strengthen voluntary control. In severe phases, some clinicians may try muscle relaxants, botulinum toxin, or mild sedatives. Prognosis depends on the cause. After stroke or surgery, symptoms often fade over time with partial recovery. In neurodegenerative conditions, improvement is typically slower. Even then, good trigger management and therapy can reduce day-to-day disruption and improve safety. 5. Hemispatial neglect. Hemispatial neglect is an attention perception disorder in which a person ignores one half of the world around them, most often the left side, even though their eyes can still see. The most common cause is damage to the right hemisphere, especially the parietal temporal regions, often after a middle cerebral artery stroke. Because the brain's attentional map is skewed, patients may eat only the right half of the plate. Draw a clock with numbers only from 12 to 6 on the right. Read a page but skip the left column and bump into objects on the left. This is not blindness. If they rotate their body or are cued to turn their head, they can detect the forgotten items. The simple mechanism to remember is the right hemisphere manages attention to both sides, while the left hemisphere mainly handles the right side. So a right-sided lesion produces left-sided neglect. Diagnosis uses bedside tests like cancellation tasks. They cross out targets only on the right. Line bisection, they mark far to the right of the true midpoint. And copying, Koch drawing, they omit the left half, together with history and a neuro exam. There's no single magic pill treatment, but rehabilitation helps. For example, systematic leftward scanning training. Prognosis depends on the location, extent of injury, and how soon therapy begins. Many people improve over weeks to months, but severe neglect can leave lasting daily life challenges. Eating, dressing, walking safely. Understanding that this is the brain choosing not to attend. Not broken eyes helps patients and families train attention in the right direction and prevent accidents. 6. Lucid dream. Lucid dreaming isn't a syndrome, but a phenomenon where you realize you're dreaming while in the dream and can often influence what happens to some degree, from changing the scene, flying, to simply staying calm and observing. It most often shows up in REM, rapid eye movement, a deep sleep stage when the brain is highly active. Most vivid dreams occur and the body is temporarily paralyzed. When parts of the frontal parietal network tied to self-awareness and control are more active than in typical REM. A simple way to unlock lucidity is to raise awareness both awake and asleep. You can try. Dream journal. Keep a notebook by your bed and write dreams down the moment you wake up to train dream recall. Reality checks several times a day and before sleep. Study your palms, pinch your nose, and try to breathe. Read a line of text and read it again. In dreams, text often warps. To build a reality testing habit you'll carry into dreams. Mild, mnemonic induction of lucid dreams. Before going back to sleep, tell yourself, when I dream, I'll realize I'm dreaming. WBTB, wake back to bed. Sleep 4.56 hours. Wake for 15-30 minutes to review your lucid notes. Then go back to sleep. This boosts the odds of hitting lucid REM. Potential upsides. Easing recurrent nightmares. Once you recognize this is a dream, the fear drops. Safe skills practice, presentations, sports, and creative spark. Downsides if overdone. Fragmented sleep, bouncing between wake and dreamlike states. And sleep paralysis, feeling awake but unable to move for a few seconds, which can be anxiety-provoking. Prioritize healthy sleep, enough hours, consistent schedule, limit lucid practice to 2-3 nights per week, and stop if insomnia or anxiety ramps up. If you hit sleep paralysis, stay calm, focus on your breathing, or wiggle a finger to break out. In short, lucid dreaming is a skill of noticing and staying steady inside a dream, useful when practiced wisely, and not at the expense of your sleep health.